All right. Hello and welcome, everyone. Thank you for tuning into this special Facebook Live broadcast. Today, we are joined by Spectrum Health Lakeland Pediatrician Ann Dudley and Berrien County Medical Director and Family Medicine Physician Rex Cabaltica. So we know that parents have a lot of questions when it comes to their children and the COVID vaccine. And so we hope to answer as many of those questions as possible here today. So we will just go ahead and get started. So at this time, only the Pfizer vaccine is authorized for use for adolescents. And we know that it's for those 12 and older. So let's just start with, is the Pfizer vaccine safe? And would you vaccinate your own children?
Yes, the Pfizer vaccine is very safe in children. We have, a lot of data to support that. I think it's normal for parents to have questions, and I want them to ask questions if they're unsure about anything that we are recommending or anything that we're asking them to put into their children's bodies. So I think that's a great question. Is this safe and is it effective? And we have overwhelming data to support the use of these vaccines in our children. And I have 4 children and one still coming, and I cannot wait until they can be vaccinated so that we can have some more peace of mind about their safety.
Also a father of 4, and yeah, we as a family actually got COVID at the turn of the year into the new year. So yeah, I come from it from a perspective of that was a bad experience, but thankfully we all got through it. But yeah, everything always has a risk, but the vaccine definitely has a lot of data behind it that gives us a lot of confidence to be able to do that and offer that. But yeah, it's always about asking the question if you have any misgivings, because we don't want you to be unsure about what you're doing for your child's health.
And one question that some people have is the science behind the vaccine, and was the process rushed because it was developed so fast? And can you just talk about that?
If I take that in?
Yeah.
Yeah, I was looking at a video that had Dr. Francis Collins. He's actually the head of the NIH who was overseeing that whole process. And to allay the fears, he was very clear that no corners were cut. What they looked at was all the downtime that happens in the development of most vaccines, and they basically cut all those out as much as possible. And so what usually would take years to develop, they were able to just streamline and make sure that was making clear headways. And the companies that were doing the vaccines were taking a risk, because potentially if their vaccines didn't work out, then they'd be out of the race. So there were about at least a dozen vaccine under trial, and only two made it across the line as far as the mRNA, and of course the Johnson & Johnson vaccine. So yeah, no corners were cut. They were just streamlining the whole process. And it was surprising that they did wait the 2 months after they completed the experimental phase before they actually launched it. And the reason why they were able to launch tens of millions of doses after 2 months was because, again, the companies took the risk that phase 2 went well, phase 3 was going well. So they had a lot of confidence to be able to put in the capital investment. So it looks rushed, but it was streamlined, was the way that Dr. Collins had described it.
And so we know that many children are not significantly or severely impacted with COVID, with only rare instances of hospitalization or death. So some parents may be wondering why their kids need to be vaccinated if they're not going to die from COVID-19. So what would you say to parents in that instance?
Yeah, I think that, that's a really great question. And although it may seem like children are not impacted, they're increasingly becoming impacted. In the last week alone, we've had 72,000 positive cases in the US of children testing positive for COVID. And that accounts for about 20% of the overall number of cases. And this is almost double what it was the week previous. So we know that children are increasingly becoming impacted, probably due to the Delta variant that seems to be highly contagious with a high viral load. Also, over 4.2 million children in the US since the start of the pandemic have tested positive. That's a lot. There have been greater than 532 deaths since the start of the pandemic that have been associated with COVID-19. And I think if you spoke to any of those families, that's too many.
There's always the risk. There's always a risk of vaccines, but often people are comparing that risk to not getting COVID. And I think that the proper comparison is what's the risk of the vaccine to what's the risk of actually getting COVID. Because if you get COVID-19, thankfully, we've not seen any pediatric deaths here within Berrien County. But there is the small risk of things like Kawasaki syndrome that you may not be hearing about myocarditis with COVID-19, but it does happen with COVID-19, the illness itself. And yes, we have seen it in a certain subgroup of adolescent males, up to age 19 seem to be at a slightly higher risk. But again, I think the thing that you need to compare is what is the risk of the actual infection versus the risk of the vaccine, and use that to make the decision.
Absolutely.
We know that we're getting prepared to head back to school. So I guess what are some of the benefits of being vaccinated as you head back to school and sort of returning to that sense of normal for some kids?
So I think that we know that children have been impacted, especially during their time at school. And there have been so many activities and events that had to be canceled or had to be dramatically changed. And we're hoping that if more children are vaccinated, that we can resume some of those normal activities. And we know that that's really important for children's mental health, for them to be in school. And being vaccinated is going to prevent or at least dramatically decrease their risk of getting sick at all. So they can hopefully not have to quarantine and will be able to attend all of those activities back to the normal way that they know and remember.
From the health department perspective, the recommendations, I want to make it clear we make recommendations, not mandates. Our recommendations to the school systems are that we need to layer the intervention. So the first layer is absolutely get those vaccines into as many people as are eligible and where it's relatively safe, and to make sure that our communities do not see the rise in numbers, because the recommendations that the health department will make to the school superintendents and boards is going to be based on the transmission within the community. And so as much as we can suppress community transmission, which is actually what drives a lot of the cases in school. It's actually not been the schools where transmission has happened, it's been the communities. But we do that by also vaccinating as many of the eligible individuals, so 12 plus and over. So yeah, it's about trying to keep the kids in school without interrupting, and the vaccine is really going to be the best way. We really don't want to have to do any other interventions like masking, and God forbid we have to close down. But I'm hopeful it won't be as bad as this coming year, but that means everyone doing the thing that's going to keep those numbers down in the community.
Many parents are also concerned about long-term effects of the vaccine, or just what's the unknowns are. So can you just discuss side effects for kids, if there's anything specific to kids, or just long-term effects of the vaccine in general and what we know?
So I think we have lots of data from many different vaccines, but including this vaccine, that there historically have been no long-term side effects that have ever occurred from a vaccine that were not discovered in the first 2 to 8 weeks. So very commonly, if there is some kind of side effect, it happens right away. There aren't things that happen years down the road that we then go back and can attribute. So there are no long-term side effects that we know of right now. And the trials are still ongoing for our younger kids, but we've had that 2-month plus time period. Now it's been several months since those first kids that were in the studies have been followed and researched. And we know that there are no long-term side effects from these vaccines. And there's no biologic plausibility. There's no known reason why they should happen after this time period, that 2 to 8 week period after receiving the second dose.
A lot of people are hesitant about the mRNA vaccines because it's a completely new technology. But if you understand how the previous technologies worked, it's basically the introduction of a vector, of a virus that actually gets your body to produce the protein, but it uses, previously it used to be a virus. Sometimes we would just kill the virus, and the dead virus would be just by itself the thing that would trigger the immune response. What this actually does is it's a cleaner mechanism where it introduces it without a virus, and it causes your body's mechanism to just produce that protein on the surface. And it's that mechanism that's focused on, that has nothing to do with your DNA. And so we have a lot of confidence that it's not going to have long-term side effects, but yeah, due diligence is that we continue monitoring. And I think that may be one of the reasons why we still haven't seen any of the vaccines fully approved by the FDA, because they want to do the due diligence that once they say it's approved, then we have very, very strong confidence that there's no long-term side effects from that.
And there have been a few reports of kids having heart issues after getting the vaccine. What is known about myocarditis from the vaccine?
So the number of cases has been the highest in the 12 to 15-year-old age group for boys specifically. And it's been about 65, 67 cases per 1 million doses given. And in that same age group for girls, there's been about 8 to 10 cases per million. And myocarditis is inflammation of the heart tissue. The cases that have occurred with the vaccine or post-vaccine in those small number of children have all resolved within 2 to 3 days, usually with the use of anti-inflammatory medications. This is a really small number compared to the really high risk of getting myocarditis from other viruses, including COVID-19, which we know myocarditis is a known and dramatic risk that you can get from just getting the illness itself.
And a similar concern about how the vaccine can affect child's fertility or menstrual cycles. Do you have any thoughts on that?
Yeah, this is a really interesting thing that happened. And when researchers have looked into this, it was all started just sort of out of the blue. There is no biologic plausibility. It doesn't make sense scientifically that this type of vaccine would be able to cause any changes in fertility. We think that it was started from some concern about the similarity of the chemical, the spike protein, its actual compound structure. And then someone said that it was similar to the endometrial protein structure, which it's not. But once that data, that misinformation or disinformation was put out there, that's really hard to combat. So unfortunately, it's been a circulating idea, but it's completely false. There is no known risk to fertility or to menstrual cycles that is caused by the vaccine. There's many reasons why girls miss their periods or why women miss their periods. And so that may be something that some girls, that time association from when they got the vaccine to when they missed a period, that they thought they were related, but there's no data that supports that at all.
You know, just from a family physician perspective, when I was seeing the adolescent and young adult women in my practice, yeah, that was one of the main concerns in terms of, why is my period irregular? And so that's just a very, very common problem that for it to be associated with the vaccine, again, as Dr. Dudley had mentioned, there's no plausible biological mechanism by which we can see that. You know, the one thing that I'd heard was the syncytin 1 protein, which there's not any clear correlation that I'm aware of. If there is, I'd be happy to see that data. But again, someone throws out a technical scientific term, it unfortunately can carry a lot of weight until you start digging deeper into it and saying, what does that actually mean? Do we actually have laboratory data that backs that up? And if it's simply just words on a page, then I'd really just look deeper and say, is that really something that I need to pay attention to, or is it just static, for lack of a better term, of what we do see a lot on the internet?
And people also have questions whether the vaccine can alter their child's or their own DNA. Can you address that concern?
I think we already, sort of mentioned that, but this vaccine, the way that the Pfizer and Mrna vaccines work, when that mRNA enters into your cells, it tells your cell to produce antibodies, and then it goes away. It is not going into your DNA. It doesn't have access into the nucleus of your cell, so it's not able to enter and to cause any kind of change in your DNA. It's not possible. It is simply a messenger. It's simply delivering a message, and then the body uses different enzymes to break up that message, and then the antibodies are produced. So within 72 hours, the actual components of the vaccine are gone from the body. So no, it does not change your DNA.
Thank you. And what if a child has already had COVID? How long is their immunity, and why should we add the vaccine on top of that? So that question of natural infection being better than vaccine immunity.
Yeah, we've been wondering that in the health department as well, because we want to pay attention to the fact that there are a significant number of recovered individuals, and so do they need to get the vaccine? I guess the below down answer on that is that we don't know. We've been able to follow those people, and it seems that the risk of infection is almost as low, if not lower, than the virus. Than the vaccine itself, vaccine-induced immunity. There's some indications from studies out of Israel that actually natural immunity might be stronger, but again, that's divided their own experts, so it's not clear how to interpret that. But we're waiting for guidance for the CDC to say they see the whole picture from across the United States. They'll have the power to be able to look at the data and say, yeah, it looks like the risk is much is at least as low as from the vaccination. But unfortunately, we don't. We're all learning in this process, and we can't tell you this is what the truth is. We can tell you this is what we're seeing. We do see reinfections in the older folks. Yes, it can actually lead to death in those with comorbidities, but we just don't know how long yet. We're pretty confident that at least 3 months, probably 6 months, and I think probably on down the road in a year's time, we'll probably be able to say, yeah, probably a year as well. So.
Well, and I think that you would agree, Dr. Cabaltica, that the risk, taking a risk and hoping that you get natural immunity is so high, and it's such a gamble compared to the vaccine. The data supporting the vaccine safety and the really low risk of side effects vastly outweighs any possible benefit that you could have from getting COVID, if you can even say that. The long-term side effects from the COVID illness, we know that there are children even that are suffering with long COVID symptoms, headaches, fatigue, mental health changes, even lasting months out. I just saw a study that there was a small percentage of kids that had symptoms even 60+ days after the infection with even a mild case. So I think that we know that the gamble of getting the infection is so great compared to the known and very small risks of getting the vaccine.
That's a good point, Anne, because I know that there's a significant number of adults that get long haul COVID, and actually one of the things I try to tell some of the patients and other folks question whether or not to get the vaccine is that those who suffer from long haul COVID, 20 or 30% of them will actually see those symptoms improve after the vaccination. So that might actually be a reason just all by itself. If you've got long haul COVID, you might want to think about the vaccine, because there's some good evidence, not absolute, but some good evidence that would give me that would support recommending that to anyone with long haul COVID. So,
right.
And it's also important to note that there is no waiting period to get vaccinated after you've had COVID, so you can receive the vaccine as soon as your isolation period is over. If you were treated with COVID monoclonal antibodies, you do need to wait 90 days, but otherwise you were able to get that vaccine. All right, and so we do know that it's still unknown, but do you want to talk about when we think we'll have a vaccine for children younger than 12 years of age?
We do know that the mRNA vaccines are all being trialed in 11, I believe it's 5 to 11-year-olds. And so we're hopeful that I think within the next within the next month or two by fall, hopefully in time for school. We'll have some of those under EUA. Now, it is EUA, it's not fully approved, because again, the FDA is trying to do this lockstep, making sure that we have the proper authorizations at the right evidence levels. So I'm hopeful a couple months. I don't know, Anne, have you heard anything coming out sooner than that?
No, I think it's been, the soonest that I've heard is possibly September, but that date is always moving. And I think one of the reassuring things to me as a pediatrician and as a mom is that I know that they've enrolled even more participants recently because they want to make sure that they have really great data for us that supports the safety and efficacy of these vaccines in these younger kids. And they're also following them for a longer time period. It's extended beyond the 2-month period that they did for the other trials. So we know that they're really taking a close eye on the younger kiddos and that we're really trying to make sure that they're definitely safe when using this vaccine.
And what if a child has drug allergies or different allergies? Can they still get the vaccine?
Yeah, absolutely. So we know that, people have allergies, and we know that there have been some really, really rare incidences of anaphylaxis or that really severe allergy reaction after the vaccines. We know that it's mostly seen in older women. It has been the highest incidence. Not necessarily if we know that you have a drug allergy, you'll have to, speak to your physician specifically if you have a particular allergy that you know of. But one compound that could be causing some of the anaphylactoid type reactions that we're seeing, which means anaphylaxis-like, but not true anaphylaxis. Those are happening from something called PEG, or polyethylene glycol, which is a commonly used substance in many household goods, many medications, many like shampoos and lotions and that kind of thing, toothpaste. So if you know that you have a PEG or a polysorbate, those are two very similar chemicals. If you know you have an allergy to one of those, you should speak to your physician. But as far as other drug or medication or environmental or food allergies, it's very likely that you can get these vaccines. It's just recommended that you bring your EpiPen and some Benadryl and that you're monitored for about 30 minutes after, just to make sure that there's nothing unknown or unexpected that happens.
And from a health,
I'm sorry, go ahead.
just to add, from a health department perspective, we got so many questions of, I have allergies to this, and I want to try to just push the importance of your primary care pediatrician or internist, that they're the ones that are going to know your history best. We can answer some general questions about vaccines, but so we welcome those who have no questions, no allergies. But if you have any hesitancy, any questions, please do ask your physician. They know your history best, and they can make that individual decision with you.
And we also know that flu season is around the corner as well. If someone is coming in for their annual visit, is it safe to get the flu and the COVID vaccine at the same time?
Yes. Yeah, definitely. We can get any vaccines at the same time as the COVID vaccine, and many primary care offices have them available. So you can actually get them at the same time as other vaccines. We know that, that we see kids a lot for their routine immunizations as well. And there's no waiting period to receive the COVID vaccine.
Yeah, just again, as evidence of the ongoing monitoring that happens in this process, we weren't able to say that with any degree of confidence when these vaccines first came out, but because of the monitoring, and again, just further research into what is the mechanism that these vaccines work out, we have confidence now to be able to say, yes, go ahead and do it, because obviously influenza has the same seasonality as what we've seen with COVID. So yeah, by all means. So we're glad to be able to make that recommendation finally.
And if someone is interested in getting their children vaccinated, what are some of the options here locally where they can do that?
Again, at the health department, we've got the immunization clinics every Wednesday. There are also some any of your walk-in clinics. I think all of them have been stepped forward to be able to offer that to walk-ins as well. We take walk-ins as well on those Wednesdays, both in Niles as well as in our Benton Harbor offices.
Yes, and there's several, open clinics throughout Spectrum Health Lakeland, including my clinic, that offer the vaccine as well.
And don't forget the pharmacies and Meyer.
Yeah, so lots of different options available. And for the most up-to-date information on all of those listings, you can go to spectrumhealthlakeland.org/vaccine or bchdmi.org/COVID-19. You'll be able to see all the locations, and you can also schedule an appointment at some, and many are walk-ins as well. So we're just coming up on time here. I want to open it up to both of you for any closing thoughts for parents or children in the vaccine that you want to share.
Thanks, Jessica. I would love to just further reiterate that the reason why I'm here and why I'm recommending this vaccine is that, I am in this vocation because I love children and I love my patients and their families, and I'm really dedicated to helping protect them in as many ways as possible. And I really believe that this vaccine is safe and effective for our children. I can't wait to get my own children vaccinated. Like I said, my husband and I, we're both physicians. We've both been, in this pandemic fight for, the last year and a half, and we're really happy that our family can be protected, hopefully in the next couple months. I would certainly recommend it for pregnant and breastfeeding moms as well. And I'm really encouraged that hopefully we'll have this vaccine available for children, down to age 5, and then hopefully even down to age 6 months in the next several months. So thanks for having me. It's been an honor.
I think the message that I'd like to leave in everyone's mind is that we're here to try to help. We're not here to coerce. We're not here to twist anybody's arm. If we're really supporting the vaccine, it's because we have that kind of confidence. I'm here at the health department because it's always been about trying to do the best for my neighbor, whether it's the one next door or whether it's the one in the county. And so that's hopefully the message. And if there are any questions that come up, I'm open to people just coming in and asking our nurses, or if there's some highly technical questions about the research behind it, I'm also open to just sitting down and hashing out those numbers and helping you understand that I think truth always comes out, thankfully. And I think as we look back at this probably 2 or 3 years from now, I think we'll be glad that we kept the conversations going and that we kept reaching out to our neighbor in loving concern. So thank you for having me, Jessica.
Great. Well, thank you, Dr. Dudley and Dr. Cabaltica for joining us today. And thank you to everyone who tuned in on Facebook or watches the recording later. We hope you have a great rest of your day.